I had a synthetic bypass that lasted 14 years. It was above the knee, so it had a good landing zone, and it shut down shortly after that amputation. Now, is it true? Other doctors have told me this, but you know how I trust, a few people.
Yeah, I'm
Only you.
aware.
Is it right? Is that because there is no outflow or to the lower part of the limbs, which that feeds? Yes, that it is typical that shuts down in an amputee.
Yeah, so for any bypass or honestly any intervention to succeed, you need to have outflow. There's no use of having water coming to your faucet, but your faucet's off. You're not going to have water running. So if an amputation is done and that's providing a lot of the outflow for your bypass, there's a strong chance that all that resistance that your blood is getting in the bypass causes it to cause turbulence. So blood clots usually because of a couple things. It's like turbulence, something blocking it, causing the blood to kind of clump up together. So if the outflow is narrow or blocked, then it's going to catch up on itself and then it clots. So it's not unlikely that the amputation may have induced the reason for the bypass to go down.
Okay, and that's where the profunda picks up the excess work.
Correct. The profunda
Okay,
starts getting bigger and bigger and bigger, trying to provide these branches that come down, and kind of form blood flow to the tissues and the distal parts of the amputation.
okay, thank you.
Yep, of course.